Origin of HIV-1 in the chimpanzee pan-troglodytes troglodytes. We have screened many chimpanzees. In the United States, chimpanzees have often been used in research on hepatitis agents. Maryland's HIV-1 positivity, presumed infected in the 1950s.
The serum hepatitis-related antigen in illicit drug users at Harlem Hospital and New York Hospital Cornell Medical Center between 1968 and 1969. A partial exchange transfusion of the chimpanzee with fresh human blood. The antigen found in chimpanzees appears to be indistinguishable from the human hepatitis-associated antigen. Cross-circulation between a patient in hepatic coma and a chimpanzee. The artery from the chimpanzee was connected to the vein in the patient and artery of the patient to the vein of the chimpanzee. These experiments and our previous experience, including transplanting chimpanzee kidneys into human patients, have convinced us that cross-circulation of patients with non-human primates of compatible blood type is a safe procedure, which need not be delayed until the patient is moribund. The simple method of exchange transfusion described here greatly simplifies the preparation of the primate animal, and thus renders the whole procedure of cross-circulation more readily available than it was before development of this method. Primate animals should be compatible in their human-type blood groups with the human patients. These animals harbor a large variety of viruses, some of which may result in fatal disease.
An epidemic known as Junkie Pneumonia raged among injection drug users in New York City. The virus entered this drug-using group during the mid-1970s. An early case of AIDS in the United States was in a female baby born in New Jersey in 1973 or 1974. These children did not receive any known transfusions prior to developing AIDS and were born to mothers known to be IV drug users.
U.S. patent filed 1975. Vaccine for active immunization containing hepatitis B surface antigen. Plasma used as source material is obtained by conventional plasmapheresis procedures from chronic HBsAg carriers. These may be humans or animal species such as chimpanzees. The chimpanzee offers the practical advantage. These animals can be conveniently plasmapheresed at frequent intervals. Participants were recruited from approximately 13,000 homosexual men from New York between 1974 to 1978. A new hepatitis B vaccine from chimpanzee plasma. 4 lots have passed chimpanzee safety tests. 2 of them have been tested in clinical trials. The emergence of HIV-1 group M subtype B in North American men who have sex with men was a key turning point in the HIV/AIDS pandemic. We report 8 coding complete genomes from U.S. serum samples from 1978 to 1979, 8 of the 9 oldest HIV-1 group M genomes to date, collected from men who have sex with men cohort patients in New York City and San Francisco.